Newborns of diabetic mothers are at risk for hypoglycemia due to high insulin production. Maternal hyperglycemia leads to excessive fetal insulin. After birth, the sudden withdrawal of maternal glucose results in neonatal hypoglycemia. Understanding this mechanism is crucial for managing newborns at risk. Infants born to insulin-dependent mothers face increased risk of cardiac anomalies. Maternal hyperglycemia has a teratogenic effect, heightening the likelihood of cardiac defects. Recognizing these risks allows for early intervention and management in affected newborns. Vitamin K is administered to newborns to prevent hemorrhage due to sterile intestines. Newborns lack the gut bacteria needed to produce vitamin K, essential for clotting factor production. This preventive measure is vital for reducing bleeding risks in the early days of life. The rooting reflex is tested by stroking an infant's cheek, prompting the infant to turn the head and open the mouth. This reflex is crucial for feeding and indicates normal neurological development. Observing this reflex helps assess the infant's readiness for feeding. A positive Babinski reflex in newborns is indicated by the incurving of toes with fanning out. This reflex is a normal finding in infants and reflects neurological health. Monitoring this reflex helps in assessing the development of the nervous system. The Moro reflex is assessed by lifting and suddenly lowering the newborn's body, causing bilateral arm extension and leg flexion. This reflex is a normal startle response and is important for evaluating neurological function in newborns. The palmar grasp reflex involves an infant wrapping fingers around an object placed in the palm. This reflex is a sign of normal neurological development and is essential for assessing motor function in newborns. The gallant reflex is tested by holding an infant prone and stroking the lateral aspect of the leg. This action causes curving of the trunk, indicating normal spinal cord function. It's a key reflex for assessing neurological health in infants. Phenylketonuria, PKU, is caused by a deficiency of phenylalanine hydroxylase. This enzyme deficiency impairs phenylalanine metabolism, leading to potential mental retardation if untreated. Early detection and dietary management are crucial for preventing complications. A characteristic sign of osteogenesis imperfecta in newborns is blue sclera. This condition also presents with brittle bones and recurrent fractures. Early diagnosis is important for managing symptoms and improving quality of life. Galactosemia is caused by a deficiency of beta-galactosidase, leading to improper metabolism of lactose. This condition requires early detection and dietary management to prevent serious complications such as liver damage and developmental delays. Toxoplasmosis is most likely transmitted through contact with raw meat or cat feces. This torch infection poses significant risks during pregnancy, making prevention and awareness crucial for expectant mothers. Cytomegalovirus (CMV) transmission risk increases in daycare workers. These individuals are more likely to come into contact with infected urine, highlighting the importance of hygiene and preventive measures in such settings. Pulmonary surfactant sufficient for normal function is produced by 34 weeks gestation. This surfactant is crucial for reducing surface tension in the lungs, preventing respiratory distress in newborns. Understanding its development is key for managing preterm infants. Newborns at risk for respiratory distress due to insufficient surfactant include premature infants and infants of diabetic mothers. These groups require careful monitoring and potential intervention to ensure adequate lung function. Assessing for cephalohematoma must be performed by an RN, not a practical nurse. This task requires the judgment and skills of a registered nurse, emphasizing the importance of appropriate delegation in clinical settings. The normal appearance of meconium stools is black, tarry, and sticky. These stools are typical during the first 24 hours of life, providing important information about the newborn's digestive function. By day 3 of life, newborn stools typically change from black to greenish-brown. This progression from meconium to transitional stools is a normal part of digestive development in infants. Breastfed infants typically have stools that are bright yellow or golden and pasty. This consistency reflects the digestion of breast milk and is a normal finding in healthy breastfed babies. Bottle-fed infants typically have stools that are pale yellow to tan and formed. This stool appearance is normal for infants on formula, indicating proper digestion and nutrition.